Stomach. It is the most dilated part of the digestive tube which intervenes between the esophagus and duodenum. That is, it is the most dilated tube which lies between the esophagus and duodenum. Situation. It is mainly situated in the left hypochondrium and extends into umbilical and epigastric region. See, these are the 9 regions of the abdomen. You have, this is the epigastric region, this is the umbilical region, this is the left hypochondrium. So the stomach mainly situated in the left hypochondrium extends into epigastric and umbilical region. Capacity. The capacity of the stomach in newborn is 30 to 50 ml. The capacity of the stomach in adult is 1500 to 2000 ml. Shape. The stomach is J-shaped. In cadaver, it is sickle-shaped. Clinically, the stomach is divided into 3 types: sthenic or normal type, where the long limb of the J is slightly oblique. Number 2, hyposthenic, where the long limb of the J is vertical. So the food and drinks we take will directly fall on the lesser curvature. So it is prone to suffer from gastric ulcer. Third type, hypersthenic. In this type of stomach, the long limb of the J is more oblique. So the lesser curvature is not affected. So the person with this type of stomach prone to suffer from duodenal ulcer. So there are 3 types of stomachs clinically. External features. Stomach has 2 orifices, cardiac orifice and pyloric orifice. 2 curvatures, lesser curvature and greater curvature. 2 surfaces, anterior surface and posterior surface. Cardiac orifice. It is the junction between the lower end of the esophagus and stomach. Pyloric orifice. It is the junction between the lower end of the stomach and duodenum. Lesser curvature. It is the right shorter curvature, that is, it is the shorter curvature present on the right side, which gives attachment for lesser momentum. Greater curvature, it is a larger left curvature, which gives attachment for greater momentum, gastrosplenic ligament and gastrophrenic ligament. Subdivisions of stomach. The stomach consists of 4 parts. Number 1, cardiac part or cardia. Number 2, fundus. Number 3, body. Number 4, pylorus. Cardiac part or cardia is a small part present near the cardiac orifice. Fundus, it is a part of the stomach which lies above the level of cardiac notch. So above this notch, the part of the stomach is known as fundus. Body, it is a part of the stomach which lies between the fundus and pylorus. Pylorus, it is the lower part of the stomach which consists of okay, pyloric antrum and pyloric canal. The upper, okay, broader part is known as pyloric antrum and the lower narrow part is known as pyloric canal. Peritoneal attachments of the stomach. The stomach has the following peritoneal attachments. Number 1, lesser omentum. Number 2, greater omentum. Number 3, gastrosplenic ligament. Number 4, gastrophrenic ligament. Lesser omentum, it is a fold of peritoneum which extends from the lesser curvature of the stomach to the hilum of liver. Greater omentum, it is a fold of peritoneum which extends from the right 2/3 of the greater curvature to the transverse colon. Gastrosplenic ligament, it extends from the greater curvature to the hilum of spleen. Gastrophrenic ligament, okay, it extends from the upper part of the fundus of the stomach to the diaphragm. Phrenic refers to the diaphragm. Relations. The relations of the stomach includes anterior relations and posterior relations. The anterior relation of the stomach is formed by liver, diaphragm, and a small part in between these two by anterior abdominal wall. So the anterior relations are formed by liver, diaphragm, and anterior abdominal wall. Posterior relations. The posterior relations of the stomach are formed by the following structures, which forms the stomach bed. Okay, it includes number 1, left suprarenal gland, number 2, left kidney, number 3, spleen, number 4, pancreas, number 5, splenic artery, tortuous splenic artery, number 6, transverse mesocolon. The transverse mesocolon is short, the transverse colon comes into relation, and finally here this part is related to diaphragm. So these are the structures forming the posterior relations of the stomach. Blood supply. The stomach is supplied by the following arteries. Number 1, right gastric artery. Number 2, left gastric artery. Number 3, right gastroepiploic artery. Number 4, left gastroepiploic artery. Number 5, short gastric artery. And finally the number 6, posterior gastric artery. The right and left gastric artery lies along the lesser curvature. The right gastro and left gastroepiploic artery lies along the greater curvature. The short gastric artery lies near the fundus, and the posterior gastric artery lies on the posterior surface of the stomach. Venous drainage, okay, it is drained by right and left gastric vein, right gastroepiploic vein, left gastroepiploic vein, and short gastric vein. All these veins finally drains directly or indirectly into the portal vein. Nerve supply. The stomach has both sympathetic and parasympathetic nerves. Sympathetic is derived from T6 to T10 segments of the spinal cord. The parasympathetic is by right and left vagal nerves. Lymphatic drainage. The stomach is divided into right 2/3 and left 2/3 by a vertical line, okay, by a line running along the long axis of the stomach. The right 2/3 in turn divided into upper larger part, lower smaller part. The left 1/3 is again divided into upper smaller part, lower larger part, and they are marked as A, B and C and D area. Area A drains into left gastric nodes. Area C drains into right gastric nodes and hepatic nodes. Area B drains into pancreatico-duodenal nodes. Area D drains into pyloric nodes and right gastroepiploic nodes. So this is the lymphatic drainage of the stomach. Clinical anatomy. Gastric carcinoma. It is commonly found in the pyloric antrum along the greater curvature of the stomach. Vagotomy. It is a surgical procedure for cutting the vagal nerve to cure the chronic ulcer. Gastric pain. The gastric pain is referred to the epigastric region because the stomach and this segment is supplied by the same nerves, that is T6 to T10 segments of the spinal cord. Thank you.